is that the sickness bill for people who are basically on benefits is rising at the tune of £266 million a month. Quite remarkable. And this is obviously because people's mental health has been affected by all manner of things. And it's £1.3 billion that we'll be spending extra on sickness benefits by the time the Labour Party and the Labour government has launched a review into what to do about it. Let's find out why so many people are off sick. Sophia, very good morning to you.
Good morning.
I mean, that's the first question, really, isn't it? Why are so many people off sick? And why are we expecting so many more of them to be off sick?
Well, I think the COVID pandemic has had a huge impact. Before that, we were really kind of on par with our European neighbours in terms of health-related economic inactivity. But now we're not, and we're really an outlier. And it, as you said, is only going to get worse. Some forecasts saying 100 billion by the end of the Parliament, some up to 120 billion. So this is a problem that is not going away. And I think there are some reasons why we, particularly as the UK compared to other countries, are potentially sicker. Some of it is also the processes of the getting access to welfare. So, for example, over 90% of applications for Fit to Work notes, which is what a healthcare provider would sign to say that you're well enough to work or not, get approved. So therefore, people are said that they're not fit to work. That's a very high number. And another reason is that we are not very good at, once people get off the system of not having the conditions of the welfare system, so being on universal credit, once they get out of that system, they are left for sometimes indefinite periods on their own without a check-in to bring them back into the conditionality of the welfare system. So this is a problem that is not going away. And while the government have tried to tackle this issue, the white paper came out yesterday, Get Britain Working. And at the Centre for Social Justice, we think the instincts are right to try and tackle this, and the Secretary of State for Work and Pensions is moving in a good direction, trying to devolve employment support, although the 240 million we don't think goes far or fast enough. It is just too slow. As you said, these costs are spiralling all the time, and it's all well and good increasing national insurance hikes on employers to try and increase the coffers of the Treasury, but that is going to be completely dwarfed by a ravenous welfare system unless this problem is solved. So unfortunately, I think the white paper does not go far or fast enough.
No, well, let's have a look at what Liz Kendall had to say in Parliament yesterday. She's the Work and Pensions Secretary.
Today, I can announce we will bring job centres together with the National Careers Service in England, beginning with a Pathfinder early next year, backed with £55 million of initial funding. We'll work closely with mayors and local leaders to ensure our new Jobs and Careers Service is rooted in local communities and properly joined up with local help and support. And we'll work closely with employers to develop the service too, because when only 1 in 6 businesses has ever used a job centre to recruit, this has got to change.
Well, the problem is, of course, as you pointed out, Sophia, putting up national insurance costs and putting up, energy costs as well, or failing to cap energy costs, shall we say, is making it more and more difficult for companies to recruit more people anyway. Most people have said in the CBI that basically they're not going to be hiring anyone in the foreseeable future because it's too expensive.
Exactly. So we need the employers to get on board with this plan of recruiting people that maybe are more difficult initially to get into the workplace, and having that mission of seeing their kind of social good of bringing people into work who have not been in work for a long time or perhaps ever. And yet, on the other hand, if they are feeling squeezed on their finances, that's going to be difficult on their bottom line, which is obviously what they ultimately exist for, which is not a bad thing at all. That is how the economy is powered, through their profits. So it is going to be difficult for the government to stand on both sides in terms of wanting employers to be involved, but also increasing the pressure on employers on the other hand. But I think what the Secretary of State said there in the clip is important to note, that a lot of the announcements that she has made are unfortunately not new, and they are not new money either. So a lot of the policies put in place by the previous government, who also identified this as a huge issue, and rightly so. I think it's one of the biggest issues facing the future of this country. They'd already moved towards this model, and a lot of what the current Secretary of State has announced is replicating that and just continuing those existing schemes without really changing much of the substance, maybe tweaking a couple of the names, but nothing more than that.
So what would you do if you were able to advise the Secretary of State from the point of view of the Centre for Social Justice? What should she be doing, do you think?
So the Centre for Social Justice, we want to see £6 billion of devolved employment support. So moving money that is already accounted for, this is not a new spend, moving it away from central devolved DWP into the regions administered by mayors and councils who are closest to the employment market that they want to see people move into and know the communities that they support the best. And so this is about giving very tailored support for people who are far from the employment market. We call it universal support. The government have renamed it Connect to Work. In some respects, it's basically the same thing. But moving that money to the areas of the country, particularly where there are high levels of economic inactivity, and moving it to those who are best placed to tailor it to their communities. That is what has worked in the Netherlands. So in the Netherlands, they did that model, and they have an employment and economic inactivity rate that far outstrips what we have here. They have seen an increase in workforce participation, 3 times what we've seen in the UK. They have smashed through that 80% employment target that the government had initially set in the UK, and they've done that in the Netherlands. So there is a blueprint for what works. We just need to learn from it and implement it here.
OK. Sophia, thanks very much indeed for talking to us. Sophia Warrington, the Deputy Policy Director at the Centre for Social Justice, says that the Liz Kendall reforms for getting rid of the sickness benefits, or at least cutting them back, is not really going far or fast enough. So they need to do more.